Good evening, everybody. Welcome to Style Wednesday with the Queen of Style. And this evening, I have my special guest, Dr. Hazel Laws, CMO of St. Kitts and Nevis. Welcome, Dr. Hazel. How are you?
Fine, thank you. And good evening, Wendy, and thanks for having me.
You are so credited and helpful for containing the first waves of infections and putting a flattening curve of COVID-19 global pandemic in St. Kitts and Nevis. We have responded to COVID-19 pandemic for over a year. Congratulations.
Thank you.
I must say, I am feeling very guilty and especially proud when I hear your accomplishments, not just for St. Kitts, but for Molyneux. I have always looked up to you as a big sister, seeing you grow as your brother was my classmate.
Yes.
So thank you once again for being on Style Wednesday and taking the time out your busy schedule, which I know you do have, and spending a little bit of time with me tonight on Style Wednesday. So, Doctor, tell us about who is Dr. Hazel Laws, personally and professionally.
Who is Hazel? A very good question. Well, let me start with my professional life. So first and foremost, I'm a physician. I have been for almost 29 years now. I studied at the University of the West Indies. That's the Mona campus in Jamaica. So I practiced there for quite a while. And then I was asked to return home to serve as the chief medical officer. And so in September of 2016, I returned home and I have been here since. And it's been a pleasure serving my people. I am very grateful for the opportunity whereby I could serve and give back to the community that has made me into the person I am today. Now, in terms of personally, I am the mother of a young adult. She's 25 years of age. I'm very proud of her. I think that's one of my main achievements, really. Personally, I like traveling, I like reading, and I love lawn tennis.
Wow, I did not know that. Amazing. A challenge one of these days. Yes.
All right, so I look forward to that.
So, what inspired you to become a medical doctor?
Okay, very good question. So you're taking me back to my youthful years. I remember I was a teenager when my uncle died of diabetes. He had an amputation, a below ankle amputation, then he had another one, the same leg, below knee, then above knee amputation. And then I think within a few hours of that last surgical procedure, he died. And I remember thinking to myself, he had diabetes, however, his lifestyle wasn't appropriate. He ate what he shouldn't. And so I became very aware of conditions that were medical conditions in which individuals had to be very particular about lifestyle. And so I learned very early the importance of preventive medicine. And so I think that really brought medicine to the fore for me. And secondly, my dad, my father, that's Franklin Laws. He always, suggested, look, when you are trying to choose a profession, try and choose a profession whereby you can be self-employed. And so medicine, was that for me. I chose medicine because one, I felt the need whereby I can contribute in terms of preventive care, public health, and then again, it's a profession whereby I can be self-employed.
Amazing, amazing, amazing. And I could remember briefly your dad always the entrepreneur and having
Yes,
that great spirit. So, you know,
yes,
he passed, but definitely great inspiration.
yes, yes.
Briefly share your path on becoming the CMO, the Chief Medical Officer of the Federation of St. Kitts and Nevis.
Okay, the path in terms of well, I did my primary education here in St. Kitts, my secondary school education here, and then I went on to Jamaica at the University of the West Indies, where I studied undergraduate medicine, and then I went on to postgrad, where I got my master's degree in public health. And so I spent a number of years in the field of public health in Jamaica. I also joined the staff within the Faculty of Medical Sciences at the University of the West Indies, Mona campus, where I lectured for a number of years. And then, as I said before, I returned home in 2016 and have been in this post until then. Upon return, I was seconded from the University of the West Indies to the government of St. Kitts and Nevis for the first 3 years, but now I am here full time. Yes.
Globally, people are practicing social distancing, mask wearing, good hand washing hygiene as personal protection against the virus. To date, there have been 44 cases of COVID-19 in the Federation, and all have been recovered. In other words, no deaths and reported in the COVID-19 in St. Kitts and Nevis. The Ministry of Health was able to contain the first wave of COVID-19 cases. Our borders have been open since October 2020. During the 5 months period, 25 imported cases were added to the number of confirmed cases. How have you been able to prevent clusters of COVID-19 cases and community transmission so far?
Okay, so that's a very good question. And so, Wendy, we've been responding to this pandemic since last year, January. Now, when we started in January last year, we were very careful in terms of developing a robust border surveillance program whereby our public health nerds would be seated at the airport and we monitored the inbound passengers who were coming in from hotspots. And so that continues until today. So our border surveillance is quite good. And then in terms of in the first couple of months, in terms of January, February, March of last year, we had appropriate travel advisories whereby we limited the influx of passengers from hotspots. And then on the ground, our surveillance system was quite good. Anybody who showed up with COVID-like symptoms, we made sure to test them. So testing has been a critical part of our response. And so in the initial stages, we sent our samples to the Caribbean Public Health Agency in Trinidad, but then we had our own local lab come into the fore and they provided us testing capabilities. So testing is very, very important. And then persons who were suspected, we placed in quarantine. Those who were confirmed, they were placed in isolation. And so we were able to manage those individuals in quarantine and isolation very well. Contact tracing was also employed. That's very important. So whenever we had a confirmed case, that individual was interviewed and all their contacts were placed in quarantine, monitored, and then they would have to be tested. And once negative, they could then reintegrate into society. And then when our borders opened in the end of October, we developed a robust set of health and travel protocols. I dare say maybe the strictest in the Caribbean with our 14-day quarantine. I mean, there are still a lot of persons who, are not happy with this, But I must say to you, it has served us well, because we may be maybe just one of 3 islands whereby we did not, or we do not have clusters of cases or community transmission. All the other territories who had a shorter duration of quarantine, they experienced clusters of cases and community transmission.
Which, I do think that the 14 days have served its purpose and was actually a great initiative, and continue to be a great initiative, because you guys, Sankis has have no deaths, and the cases
Yes,
are very limited and
yes.
controlled tremendously. So
Let me add, we have, okay, because our case count is only 44, we were just lucky that the 44 persons, they were able to recover without any complications or dying. Now, once your numbers go up, it goes without saying that you will have persons who will become severely ill and will die. So we've done a good job in, maintaining or flattening the curve, as it were, meaning keeping our numbers to the lowest, such that we do not overwhelm our health system.
and, and that was impeccable. So I have to thank you for just making sure that the borders were actually secured and everyone was able to feel safe, you know,
Yes.
in such a critical world pandemic. So
I also want to suggest and to add that it's the success is as a result of our all of society approach. So it's not just one person. We were able to achieve this because of the work of the health team, because of the work of our national COVID-19 task force, led by Mr. Abdia Samuel, and most importantly, all of society. So everybody came on board, the public sector, the private sector, and all the key stakeholders within the Federation. We all came together in the initial stages. That's in March of last year, when we would have announced our first case. I mean, we had a massive education campaign where we educated our population, we empowered our people with information regarding or about COVID-19. And so everybody came on board and did their part in terms of the response to COVID-19.
amazing. I must say, when I look at the results continuously, I was proud of my country, my place of birth. I loved it. I enjoyed it. I was so proud to say that we don't have any deaths. There's no deaths. So we have a couple cases, and we were the lowest in the Caribbean. And I think that everything that the team in St. Kitts did to impact such a huge virus was amazing. And I must recommend and commend everybody on the island.
Yes, yes, thank you. Good night to Kim.
Good
Hi.
night. I do apologize for my technical difficulties. It's the joy of technology. It allows us to speak to each other from anywhere in the world, but then it doesn't always cooperate. So
Yes,
I do apologize for that.
yes.
Um, Yes, so I'll pick it up from here. So April 7th, last week, we saw it was the World Health Day, and we had the largest procurement and supply operation in history. We saw the arrival of 21,600 doses of the AstraZeneca Oxford vaccine at the Robert L. Bracha International Airport. The AstraZeneca vaccine is produced by a number of manufacturers, is what I read. And there are also other COVID-19 vaccines, the Moderna, Pfizer, Johnson and Johnson. Tell us about the COVAX facility and how was the Federation able to secure the AstraZeneca COVID-19 vaccines, please, Doctor?
Okay, so each of the CARICOM or Caribbean islands, we were invited to join the COVAX facility, which is a global mechanism whereby all territories, countries in the world, you can sign on to it. You are expected to sign an agreement, and there's a down payment that each country would have paid. So St. Kitts and Nevis signed on last year. We would have paid our down payment last October. And through that facility, you are, you are ensured to get enough vaccines to cover or provide coverage for at least 20% of your population. And so what we received, the allotment we received last Wednesday, April the 7th, the 21,600, that provides us coverage for at least 20% of our population. I must add that we had an initial allotment of vaccines. So in February, I think it was February the 11th, the Federation received a gift of 2,000 doses from the government of Dominica. And then on March the 1st, we received an additional 18,000 doses from the government of India. So we had an initial 20,000 doses. And so last Wednesday, we received an additional 21,600 doses. And it's all the same vaccine, the AstraZeneca Oxford vaccine. The only difference is the initial allotment was the dose, the first 20,000 doses were manufactured by the Serum Institute of India. And then what we received last week, the 21,600 doses, they were manufactured in Sweden. Yeah.
Okay.
So, but two different manufacturing companies. So I just wanted to clarify that.
Right. And thank you also for clarifying the different distributions, because I know that number 21,600. And so when you started in February, I thought that was what we had. Then now I see it coming again. So thank you for teasing that out and providing that for us. Thank you.
Yes, yeah. And so let me just add, vaccines right now, everybody world over require vaccines. So the demand far outstrips the supply. So it's a scarce commodity. So access to the COVID-19 vaccine is an issue. All right.
Okay.
It's not an easy thing to get your hands on the vaccines. The demand far outstrips the supply.
Yes. Well, I know I had been on a waiting list for 6 weeks, and I finally got my first shot. So I'm pleased with that.
Yeah, you have to be older to be, in the priority group.
Yes, I know that, but I like to be safe as well.
Yes.
Granted, if not all medications have side effects, the benefit of the COVID-19 vaccine outweighs the risk. Pending an investigation, some countries have suspended the AstraZeneca vaccine administration due to rare blood type clotting reporting. And what is the World Health Organization recommendation regarding this situation and development, doctor?
Okay, very good question. So there are reports of individuals who would have received the AstraZeneca Oxford vaccine and would have developed thromboembolic events. And so the World Health Organization has reviewed the reports of these rare cases of blood clots. And what the interim statement says that a causal relationship between the vaccine and the occurrence of these blood clots is considered plausible, but it's not yet fully confirmed. All right, so other research work and studies are required to fully understand the relationship between vaccination and the occurrence of these events. And so the WHO has said that we can continue the administration of these vaccines while or concurrently as their committee continue to look at this information and data. Now, the administration of vaccines is based on a risk versus benefit analysis. So to date, over 200 million persons have already received the AstraZeneca Oxford vaccine. Only a very small number of persons have reported the side effects, this rare adverse side effect. And so at present, the benefits of the vaccine far outstrips the risk. And because of that, it's recommended that we continue the administration of this vaccine.
Okay, thank you. So the Federation has been successful in ensuring the equitable distribution of COVID-19 vaccine so far. How has the rollout in St. Kitts been so far? What are some of the challenges in regard to the rollout?
Okay, and so we would have launched our rollout on Monday, February the 22nd. And so between then and now, approximately a little over 7 weeks. And so we would have administered 11,152 doses of the vaccine so far. And so in this short time, we've touched or covered 33% of the target population. So let me explain that. So what we did, well, let me just back up. The herd immunity threshold for COVID-19 is anywhere between 70 to 90%. What does that really mean? Okay, it means that each country or territory, you should aim to vaccinate 70 to 90% of your population. If you achieve that, the vaccinated individuals will provide indirect protection for the vulnerable in your population. And in our case, that would include our children, because as you know, the vaccine can only be given to adults.
Right.
So you're going to have children who can't get it. You're going to have the frail elderly who have other conditions and for which the vaccine is not, they cannot take the vaccine because of their underlying conditions. And so our aim is to vaccinate 70% of the population, which is approximately 33,000, a little over 33,000. That figure we got from our last census. And so 11,152 really means that we would have covered 34% of that target population with the first dose of the vaccine already. Okay. So we've done, for a small territory, I think we've done well in the short space of time. However, it's not without challenges. Our biggest challenge, hesitancy, vaccine hesitancy. And I'm thinking this is not just unique to us. I'm sure you're seeing it where you are also. Yes. Yeah. So that's our biggest challenge, vaccine hesitancy. So what we have is a comprehensive education program whereby we aim to empower our people with the facts about the vaccine, the facts about the disease itself, and so that they can make an informed decision and accept the vaccine.
Amazing. So, I do think that based on the percentages and the vaccines that have been given out, we're on the right path. And I think that we should see consistency and sustainability over next couple weeks and months, so we could get to that 70%, because I see you have a firm team.
Yes. And I must say that I want to use this opportunity to say that, well, when we started, we said, okay, if you want the vaccine, you can come into the nearest health center to get it. But now we are taking the vaccine to persons where they are. So we are going into workplaces, we are going to the airport, we are going into the hotels, wherever you are. And so we are conducting education sessions, and the nurses are right on hand to offer the vaccine once you say yes. I want to use this opportunity to say a big thank you to the retired nurses, your mom included, who have come on board to help in this regard. And it's tremendous because they are able to go out each day into the workplaces to administer the doses, because we don't have enough in-service nurses to provide the services in the health centers and do that at the same time. So I want to commend, I think there are about 11, 12 retired nurses who have offered their services, and we are eternally grateful to them for doing so.
I think it's definitely a win-win situation, having the nurses come back and do some more service for the country, because I know our mom definitely missed it. Yes.
I think that, when you think about even touching individuals who were so used to them back in the day,
Yes, yes.
able to actually get them and convince them of, yes, this is a must to do.
Yes,
It's
yes.
not an option.
Right.
So,
Right.
Yeah, and so again, it comes back to the all of society approach, because the retired nurses, they would have their inner circle who they can reach and
Right.
convince and to accept the vaccine, along with the in-service nurses. So everybody has a part to play. Actually, my philosophy is each one reach one. Each one reach 2 or 3 or 4 persons who you can influence, empower, so that they can accept the vaccine.
Yeah. And so do you have an estimated timeline when we can get to herd immunity, that 70%?
Well, based on the rate at which we are going in terms of 100, almost 200 per day, we can attain it by about September of this year. But then, as I said, once there is acceptance. So there are challenges that we still have to overcome. The hesitancy is real, it's significant, but once we can overcome that, we can attain the goal by, mid to end of September of this year. At the present, if we continue at the present rate at which we are going.
okay, great, doctor. I know summer is 2 months away, and everybody is thinking to travel, doctor. Are we gonna look at that 14-day quarantine being reduced or even lifted once you get that herd immunity at 70%?
Okay, so that's a very good question. And the answer to that is we are hopeful that we may be able to do so. But again, it's important to note that our health and travel protocols were developed based on science. The latest scientific information has guided us up to this point, and it has served us well. And it's wise, or it will be wise to continue in the same vein. And so at present, we are looking at the latest scientific information, the latest data regarding the vaccines and their performance. And the biggest question is, if an individual is fully vaccinated, is it possible for that individual to still transmit the virus? That's the biggest question. So if such an individual, if the risk of transmitting is reduced after you are fully vaccinated, then we can consider a reduction or a lifting of the quarantine period. It's also important for us to vaccinate a significant proportion of our population at the same time. So yes, if we were to achieve the herd immunity threshold of 70%, we can reduce the quarantine, because then the risk of spread of the virus would be much.
Right.
So most everything depends on our achieving the herd immunity threshold, or a lot depends on our achieving the herd immunity threshold.
Right, right.
That is
I,
awesome.
I know, I know. I was thinking as you were saying, there's something that I just heard on the radio earlier today, in terms of the, and I don't know if you know this, or which vaccine this was about, but it was talking about the duration of effectiveness. I don't know if you've been hearing anything like that yet. How long once the second shot has been administered would that last, or is that something still in science? Is that something that we're still waiting to hear the numbers on?
Well, that information is still being sought as we
Yes.
speak.
Okay. Okay.
Something about the Pfizer-BioNTech vaccine. I think after you are fully vaccinated, the protection can last up to 6 months. I think that's what I saw.
Yes. Yes.
Please note that these vaccines are all being rolled out at the same time, and the manufacturers are still collecting data. And so I think it won't be for another, few months before you have that absolute data or information in terms of, okay, Pfizer BioNTech provides you protection for X period of time, Moderna, and then AstraZeneca, Oxford. So there's still a lot of gaps in terms of the data, and I'm hopeful that within another 3 to 4 months, much of this information would be available.
Thank you.
Can make changes based on this information once the information becomes available.
Okay. Okay.
Thank you. Doctor, what other great advice do you have to the audience out there? What is something that you would tell us or leave us here with tonight to ensure that we're protected?
Oh, wow. What I can say is we've been responding to this pandemic for about 15 months now. It has been a long journey. We have learned a lot. Well, one thing, this virus has impacted all of our lives. And I mean, not just the health and the health system, it has impacted us socially, because we are now socially distanced.
Yeah.
It has impacted us economically. It has changed everything. The space in which we now live and operate has become so complex, and so from the very beginning, we were told that the only way out of this is a vaccine. And so the vaccines are here, and they provide the vaccine candidates, the successful vaccine candidates. I mean, those that have achieved approval for use. They provide us an opportunity to return to normal, or as close to normal as possible. And my only hope is that our people would capitalize on this opportunity. St. Kitts and Nevis, we have been lucky to access vaccines. There are many countries who cannot get their hands on vaccines.
Okay.
Lucky to access vaccines, and we need to make use of this opportunity, because it provides us a mechanism and an avenue whereby we can open up the economy, so that we can, make money and survive as we used to.
Yeah.
Great, absolutely. Doctor, is there a timeline where the country will be 100% open to everybody, meaning tourist ships, all that good stuff coming back, as you said, for us to make money again? Do you have a timeline on that?
Okay, so well, let me begin by saying the country is open. Our borders have been open since October 31st. It's just that we have the robust health and travel protocols, including quarantine, etc. And so, well, one can say when we make a change to the quarantine stipulation, if we reduce it or lift it, we would be more open. And then again, I said that depends on our achieving the herd immunity threshold. So then that's later down in the year. Today we attended a very important stakeholder meeting whereby we were informed that we will be prepared to accept cruise tourists by about the 1st of October or in October of this year. And so that's a timeline that's important, and it's important to note that. So cruise probably will return, by about October of this year. Yes, there's some consideration in terms of accepting 1 or 2 cruise vessels earlier than that, as early as June of this year, if they were to the basic requirements as stipulated by the tourism authority.
Wonderful things. I know this is a one-off, but we just had one of our sister islands who just had a volcanic eruption last week.
Yes.
What can you say that St. Kitts, what efforts are St. Kitts putting forth to help our sister island?
Okay, and so our Prime Minister would have announced a very comprehensive package of assistance to our neighbors in St. Vincent and the Grenadines. And I must say that our first shipment, I think 2 trailers of food stuff, water, etc., left the Federation and was received by by NEMO in St. Vincent and the Grenadines today. So they are already benefiting from our contribution. They would have received the same earlier today.
Mm-hmm.
Yeah.
Wonderful.
Wonderful, wonderful. So, Dr. Hazel Laws, CMO of St. Kitts and Nevis, I have to say thank you, my sincere gratitude and appreciation for you being on Style Wednesday and giving us all this amazing information. And I must commend the team out there in St. Kitts and Nevis for control. I must say, robust control on the COVID-19 and ensuring that anybody that entered and stayed in our island remains safe and continues to be safe. Doctor,
Yes.
thank you so much, and it's been a pleasure.
Yes, and
Thank you.
so Wendy and Kim, I must say it has been a pleasure, being a part of your show this afternoon. I really enjoyed the dialogue, and it's lovely to see you after so many years.
It
And
is good to
so,
see you too.
so, in the future, just reach out and maybe we can do this again. So thanks
Absolutely.
for having
Thank
me.
you.
Yes.
Thank you.
Have
All
a
right.
good night. Thank you
Have a
so
good
much.
night too. Take
You're
care.
welcome. Bye.
Bye. Bye.
Guys, there you have it on Style Talk with Dr. Hazel Laws, CMO, Chief Medical Officer of the Federation of St. Kitts and Nevis, telling us everything that they did to control COVID-19 during this pandemic. Guys, as I always say, you remember, don't let the fashion wear you, you wear the fashion. Thanks to my sponsors, B&B Braiding, Mo's Dynasty, and don't forget your skincare, look for skincare and cosmetics. Order up today. And lip gloss that I'm wearing tonight is actually a slight of Fashion Avenue News Red. All my sponsors out there. So guys, thank you again. It's been a great night. And remember, don't let the fashion wear you. You wear the fashion. Until next week, Wednesday, let's stay fashionably safe. Thank you.